A peptic ulcer is an open sore in the lining of the stomach or the duodenum, which is the name for the first part of the small intestines. Peptic ulcers are far more common in adults, but children of any age can also develop these ulcers, which may cause serious complications if left untreated. What are the symptoms of a peptic ulcer? First, ulcers don't always cause symptoms. When symptoms are present, the first sign is often a gnawing or burning pain in the belly between the upper chest and the belly button. The pain typically occurs between meals and in the early morning. It can last from a few minutes to a few hours. Less common peptic ulcer symptoms include burping, nausea, vomiting, poor appetite, loss of weight, or feeling tired and weak. What causes peptic ulcers? We used to think lifestyle factors like stress or diet caused ulcers. More recently, research has shown that ulcers can develop as a result of an infection caused by the bacterium H. pylori. In children, H. pylori is the most likely cause of peptic ulcers. Some things can make an existing ulcer worse. These may include physical stress and medications such as aspirin and ibuprofen. These drugs make the stomach more vulnerable to the harmful effects of digestive fluids. How are peptic ulcers diagnosed? The treatment for peptic ulcers is different depending on what is causing it, so it's important to diagnose peptic ulcer disease correctly before starting treatment. Your child's healthcare provider will complete a medical history and physical exam. Other diagnostic tests may include blood, stool, or breath tests. These tests are performed to detect signs of blood loss, inflammation, and the presence of H. pylori in the stool or poop. Endoscopy, a test that uses a tube about the width of a finger with a light and a tiny video camera on the end called an endoscope. The endoscope is used to look at the inside of the digestive tract. Small samples from inside the digestive tract may also be taken. Or upper GI or gastrointestinal series. An X-ray exam is done using a swallowed contrast material that outlines the GI tract. How are peptic ulcers treated? In the past, providers often advised parents to avoid feeding children with ulcers spicy, fatty, or acidic foods. But we now know that a bland diet is not effective for treating or avoiding ulcers. For most children with ulcers, there is no particular diet that helps. These days, providers may treat ulcers with medication, including H2 blockers to reduce the amount of acid the stomach produces, or proton pump inhibitors that completely block stomach acid production. A drug that protects the stomach's mucus lining from acid damage may also be prescribed. If H. pylori is shown to be the cause of your child's ulcer, they will also be prescribed antibiotics. In most cases, anti-ulcer medications heal ulcers quickly and effectively, and getting rid of H. pylori bacteria keeps most ulcers from reoccurring. From first conversations to treatment, Boston Children's Hospital is committed to keeping children and adolescents healthy. For more information, please speak with your primary care provider or visit bostonchildrens.org.